Thank you for the introduction and for the opportunity to present our work on this conference. My name is Michał Walczak, and it is my pleasure to share with you some insights into polychromatic CBCT reconstruction. CBCT image quality is vital for adaptive radiation therapy. However, image quality can be compromised by various artifacts. In this work, we explore the potential of using a polychromatic model to reduce beam hardening and metal artifacts. We also intended to directly reconstruct relative electron density for the purpose of dose calculation. And to that end, we implemented a polychromatic forward projection proposed by Mason et al. Into our existing iterative CBCT reconstruction, which we call the iCBCT. And as such, this is a purely software solution which does not require any hardware modifications. In the next slide, let's take a closer look at the core of the polychromatic forward projection. As described by Mason et al., the polychromatic forward projection maps a relative electron density volume into projected intensities recorded by the detector. To carry out this mapping, we need two pieces of information. So one input we use is a spectral model of the imaging system, and the other one is a model that links the relative electron density to polychromatic attenuation of the imaged object. To describe the spectral properties of the imaging system, we run Monte Carlo simulations of the photon flux and the filtration and the detector efficiency. The resulting polychromatic error norm was calculated for each detector pixel. However, here for illustrative purposes, we show an example of a line at the central detector pixel in the left plot. In the plot on the right, you can see a visualization of the polychromatic attenuation model. And to describe the relationship between the relative electron density and the attenuations, for each energy bin, we did a piecewise linear fit for typical materials present in human tissues, these segments, as well as some common metal materials in implants in these segments. So we did this fit for several energy bins spaced by 1 keV, but again, for illustrative purposes, we only show 2 lines for selected energy bins. Now, having established the relationship between the relative electron density and the forward projected intensities, let us now take a look at how this polychromatic forward projection fits into the reconstruction pipeline. As mentioned in the previous slide, the polychromatic forward projection models only the attenuation properties. Therefore, we need to correct for scatter extra before actually running the iterative polychromatic reconstruction. And to that end, we coupled the polychromatic reconstruction with an existing pipeline in our non-clinical reconstruction toolkit called iTools. And just like in a standard iterative CBCT reconstruction, we start by pre-processing the acquired CBCT images and correct for hardware scatter, for instance, the bow tie scatter. In the next step, we run a 2-stage object scatter correction. In the first stage, we use kernel-based scatter correction and reconstruct an initial HU volume. And subsequently, we use this volume as an input for the Acuros scatter correction in the second stage. And Acuros provides a polychromatic object scatter estimate by solving the linear Boltzmann transport equation based on the HU input. Finally, we reconstruct the relative electron density volume by feeding the pre-processed and scatter corrected projection images into the iterative polychromatic reconstruction. In the following slides, I will show you the results obtained with the polychromatic CBCT reconstruction described here. As dose calculation in radiotherapy is very much affected by the quality of reconstructed relative electron density, and exactly for that reason, we investigated the accuracy of the polychromatic reconstruction. So we scanned a CBCT electron density phantom and compared the reconstructed relative electron density values with the ground truth values from the phantom specification. And to limit the influence of the scatter on the reconstruction, we actually collimated the KV blades in the longitudinal direction to match the phantom insert heights. And in the left image, you see a directly reconstructed relative electron density. And the right image shows the relative difference between the ground truth and the reconstruction calculated with respect to water. We also calculated the mean relative electron density within each of the inserts in the phantom and compared it with the ground truth values as shown in the table on the right. We found that for most of the inserts, the relative error in the mean reconstructed relative electron density was below 3%. And a recent study demonstrated that at this error level, there shouldn't be any noticeable difference in the calculated photon dose. And in fact, some clinicians would even accept a relative error in the relative electron density of up to 6%. And the only insert exceeding this 6% error threshold was in our case the solid dense bone 800. So based on these results, we would expect that the polychromatic reconstruction to yield sufficiently accurate relative electron density for photon dose calculation. As mentioned in the introduction, one of our goals was to improve image quality by reducing beam hardening artifacts. And as a test case for the polychromatic reconstruction, we scanned the electron density phantom in a configuration that was designed to be affected by beam hardening artifacts. And for this purpose, we arranged bone inserts in one row. And as you can see in the image on the left, in the standard ICBCT reconstruction, there is shading in between the bone inserts. And we contrasted that reconstruction with a polychromatic reconstruction, where we initially reconstructed the relative electron density volume, but to compare it with the HU values of the standard ICBCT reconstruction, we converted the relative electron density values into a virtual monoenergetic image by applying the polychromatic attenuation model at a selected energy bin. Here we chose the mean energy of the imaging beam, that's 66.5 keV. And as you can see in the right image, the shading in between the bone insert was reduced in the polychromatic reconstruction. And this result, as anticipated, suggests that having an explicit physics model for the polychromatic attenuation might help to reduce beam hardening artifacts. Another image quality improvement we aim to achieve through applying the polychromatic reconstruction is metal artifact reduction. As a challenging test case, we chose a CBCT image dataset acquired for a patient with bilateral hip implants. In this study, we compared 3 reconstruction methods. First, to fully visualize the extent of metal artifacts, we run a standard ICBCT reconstruction, and in the resulting images shown in the left column, you see a severe distortion in the bladder region. Next, we also run an ICBCT reconstruction with metal artifact reduction based on metal in painting. And in this case, with the results shown in the middle column, we observed increased visibility of the bladder region. However, we also noticed that the metal in painting might negatively affect certain anatomic details, particularly in the vicinity of the implants, as you can see in the middle image. We contrasted those two reconstructions with the polychromatic reconstruction. And here we used a polychromatic attenuation model that was extended to not only fit to the typical human tissue materials, but also to some common metal implant materials. And again, we converted the reconstructed relative electron density volume into a virtual monoenergetic image to compare it with the other results. And as you can see in the right column, the visibility of the bladder is also increased in the polychromatic reconstruction as compared to the ICBCT reconstruction. Still, we do see a room for improvement as there is certain level of artifacts remaining in the reconstruction. However, these preliminary results, we also see the benefit of applying a physics-based attenuation model in the polychromatic reconstruction to also tackle metal artifacts. To summarize, in this talk, I have shown you an experimental evaluation of a polychromatic CBCT reconstruction that we have implemented into our non-clinical research tool. And we have explored the potential benefits of applying an explicit spectral model for quantitative CBCT reconstruction. Here we focused on directly reconstructing the relative electron density that should enable reliable dose calculations. And we also saw some examples of image quality improvements related to beam hardening and metal artifact reductions. In the future, we plan to improve the integration of the polychromatic reconstruction with Acuros scatter correction. In its current implementation, Acuros does material decomposition into water and bone mixture only and based on HU images. So we could extend the range of materials in the Acuros model to also include metals. And instead of feeding HU volume to the Acuros as a first estimate, we could instead provide it with directly reconstructed material density volumes from the first pass of initial polychromatic reconstruction. And further, we also plan to evaluate this polychromatic reconstruction on more clinical data to examine it closely, its suitability for specific tasks that are relevant to adaptive treatment, such as dose calculation and automatic segmentation. And with that, I would like to thank you for your attention.
Paper is now open for questions. So while you're thinking, I have one question. So from my understanding, in radiotherapy, it might be interesting to, if you to visualize the whole patient, and in the case you have a limited coverage of the detector, you might have a truncated data. Here, when you use forward projectors and nonlinear methods, I just wonder how you think it will work, or if you have tested it on truncated data.
So that's a good question. We still haven't really tested it on truncated data. So at one point we were kind of close to truncation, and then we had to extend the volume a little bit, but the data itself was not really truncated. So that's definitely something we need to look into.
Okay. No other. No.
So you mentioned the metal and incorporating that into Acuros. Do you think it matters what kind of metal, like aluminum, titanium, steel?
So maybe I can go back to the polychromatic fit. As I would say, it shouldn't. I mean, just a guesstimate at this point, because we haven't still done it. But I would say I would expect those metal. I mean, here you see with squares. They could. I mean, if you choose one metal as a base component, you could scale its attenuation properties. So I would expect that you could select something like a titanium as a base material in Acuros model, and then represent all the others as a scaled version of titanium.
So those 3 points are already different metals?
Mm-hmm. Yes.
Okay.
If there are no more questions, let's talk to speaker. Let's thank the speaker again.